So personally, I have no arthrodesis case. So we together make a literature review about the arthrodesis. Perhaps arthrodesis is the second most common choice for infection after PJI revision. The advantage of arthrodesis is it can provide a stable, painless joint and satisfactory pain relief and secure the infection control. But its disadvantage is relatively poor function. The indication for arthrodesis is that the infection is not, it can controlled. And the second is chronic soft tissue problem, perhaps destroyed extensor mechanism. The control indication for arthrodesis is vascular disease and life-threatening infections. You can make arthrodesis with cement or uncemented intramedullary nails, or external fixator, perhaps sometimes plates, but the plates are really rare used. The cemented or uncemented intramedullary nail is the most common used. It is highest fusion rate, and it can avoid limb shortening when used as endoprosthesis. The external fixator can make a simultaneous limb lengthening. The plates are not really rare used. It's delayed weight bearing and low fusion rate. For one-stage procedure, you can use a intramedullary nail. First, you make a Saraf debridement and then put in the nail. One-stage procedure, you generally is considered unreliable, but is acceptable sometimes. And the two-stage procedure for the intramedullary nail is first, you put in a static spacer. After the control of infection, then you put in the nails. Of course, you can, on the second stage, you can use an external fixator. And with the fixator, you can also make a bone transport to prevent limb length discrepancy. So the two-stage procedure is a standard method. It is for the first stage is you make an exhaustive debridement and then put in a static spacer. And on the second stage, you put in a cemented or uncemented nail or with an external fixator. The three-stage procedures are really rare used. The complication of arthrodesis first is no union and then reinfection. The third one could be limb length discrepancy. Can we turn arthrodesis to a total knee replacement? There are many complications. It's not worth it. Compare the intramedullary nail with external fixator. So the intramedullary nail has a fewer revision and better function for the intramedullary nail. Compare with the two-stage reimplantation, arthrodesis can be better, have a better pain relief, but of course, inferior function. Compare the arthrodesis with the amputation. Perhaps arthrodesis have a higher physical and mental functional status, but also has other kind of other reports. They say the arthrodesis is inferior in infection control and more blood infusion. So thank you.